We're here today at the Extraordinary Futures Conference. I'm sitting down with Dr. Essam Hamza of Premier Health Group. Essam, thank you very much for taking the time to sit down with us.
Thank you for having me.
Great. Why don't we begin by you telling our audience a little bit about Premier Health, the space that you guys are in, and what you guys are focused on?
Sure, thank you. As you mentioned, I'm a family doctor. I've been in practice for over 20 years. I've also really been interested in technology, and so one of the frustrations I had as a doctor was seeing kind of the inefficiency of healthcare delivery, the frustration of calling a patient in, for them to take a day off of work, for them to come in the waiting room and sit around for an hour, and then for me only having 5 minutes to spend with them, and so their frustration as well. And so I kind of always believed in digitalization and the use of technology for the future of healthcare delivery, and so I had that opportunity with Premier Health. So Premier Health bought the clinics about a year ago, and then I came on as a CEO about a month later, and we said let's solve this problem. Let's go towards the future of healthcare, and so to do that you have to change it from a doctor-focused, a clinic-focused business to a patient-focused business. So healthcare kind of circling the patient instead of circling your doctor. And so we bought a technology company out of Victoria called Cloud Practice. So Cloud Practice was already in 300 clinics across 8 provinces. They had about 3,000 doctors and about 3 million patients in their system already. So we went from 100,000 patients to 3 million patients by that acquisition. And then we bought 2 pharmacies in Lower Mainland as well. And we focused on developing an app, and that's the future that we're going to be talking about today.
I know you talked a little bit about the clinics. Can you maybe talk a little bit about the footprint that you guys have? How many clinics, just so our audience has a better idea?
Yeah, with the acquisition of Cloud Practice, we're in the doors of 300 clinics across 8 provinces. And so those clinics, those 3,000 doctors use our technology. Their EMR, their electronic medical records, are in our system, our servers. And we have 3 million patients with their charts in our database. And so what we're trying to do is getting those patients now to download the app that we've created, this portal, that will now kind of transform the delivery of care. So instead of you taking a day off of work and going to your doctor and waiting there and being rushed out, we're changing it so now that you can download this app, you have your charts with you in your hands, you have your medications in your hands, you have the ability to connect through telemedicine to see either your doctor or one of our doctors on demand, so when you need to, from work or from home, and eventually having the prescription delivered to you as well. So now you have the whole healthcare team kind of circling you with your app in your hands, and you being able to access healthcare whenever you want, wherever you want, instead of trying to call Monday morning to make an appointment to see your doctor 2 weeks later, or running out of medications and ending up in emerge, or having complications from having high blood pressure because you didn't have your medications. So that's the stage we're at right now. We've completed all the acquisitions, and we just launched the app for our 3 million patients. And in Q1 of 2020, we're going direct to consumer as well. So we're going to have the ability for any patient across Canada to download the app and see one of our doctors on demand.
What's your app called?
So the app right now is called My Health Access. It's available to the 3 million patients in our system. We are going to be coming out with a separate brand for direct consumer, so the ones that are not already in our system. And that will be launched, like I said, in Q1. We'll have more information between now and then about how many patients have downloaded our app, are using it, and so on. And those will be kind of every few months we'll be giving updates on how much of the downloads we have and how many people are using it.
3 million people is a lot for an app. What sort of feedback do you get from your users on this app?
It's been transformative. It's one of those things where you got patients, and you guys know this as well, being in Canada, that were always frustrated. They were frustrated trying to get in on Monday morning, try to talk to the front staff. The front staff was frustrated because all they were doing is talking on the phone, and the doctors were frustrated because the front staff wasn't helping them. And so we changed that. So now our app, you're able to do 24/7 online booking. So from Sunday night in your shorts at home, you can make an appointment at any time in real time, right to your doctor's schedule. And it's been amazing. And so the ability for that to be there, for you to be part of your own healthcare and knowing about your healthcare, knowing about what medical conditions you have, what medicines you're on. I can't tell you how many times I've seen patients in my clinic and they want a prescription refill, and I said, sure, no problem. What would you like it for? And they're like, for my blood pressure. I'm like, great, which one is it? Oh, the white pill. And I'm like, I don't know what that is. And they don't know either because no one's ever shared it with them. So we're changing that. Because of privacy rules, most of your information is sitting on a shelf in your doctor's office and useless to everybody. And so now you'll be able to have it in your hand and sharing it with your healthcare team, being part of that process, messaging your healthcare providers, collecting data, so plugging in your healthcare, your monitoring devices like your blood pressure monitor or your glucometer, your scale, or your nutrition, and feeding that back to your doctors, saying, what can I do better? Or talking to your nutritionist through the telemedicine app, or talking to your pharmacist or your naturopath. And so now you have all these other healthcare workers, the whole team working together and seeing you in the middle versus you trying to, going out to all these different clinics and wasting time and being very inefficient.
Can you talk a little bit about the team you guys have put together, not just for strictly the app, but to make sure that the company succeeds, moves forward?
Yeah, so we believe in kind of experts in each part of it. So what we did was we bought the clinics, and the clinics we brought on the doctors that we have already. We have the nursing staff and the staff that are very knowledgeable and very forward-looking in their approach. We fixed a lot of the protocols over the years in the medical space, and we know what works, what doesn't work, what resonates with patients. Then we bought the health tech company that we talked about in Victoria, and they're experts in their field. They're great. We expanded their team, and we tripled their space, and they've been going gung-ho in Victoria. And then we brought experts in the pharmacy side and brought them on board, and they're going to be helping us with the fulfillment and the expansion with partnerships across the country. And so that's been very, very good. And so we're kind of looking forward now to the next phase of adding more people to our team that will actually expand that further in different fields. And I think you'll see some developments over the next few quarters that are going to be interesting to the investor.
Well, you've gone ahead and answered my next question right away, but I'm actually going to ask you an off-the-topic question. What actually excites you about this space and what's going to be happening within the next year, 2 years, 5 years?
Again, I have a lot of capital markets experience as well, and as an investor as well. And so what excites me is the fact that we're looking at less than 1% of healthcare delivery in Canada right now being through virtual care, much less than 1%. And over the next 10 years, you're going to see that dramatically change. I wouldn't be surprised you see 30 to 50% of your healthcare delivery through some sort of virtual care. So you think about the numbers and how little the space is in terms of providers. There's very few providers that are doing what we're doing. And very even less providers that are publicly available, especially in Canada. So as an investor, being able to invest in a company that is in the leading edge of healthcare disruption in a huge field, a huge market, and we have a 30 million market cap right now. We're doing about 11 million in revenues for this year, and we're projecting to do over 22 million for next year, mostly on the digital growth that we talked about with much higher margins than the brick and mortar.
Well, I'm sure you've provided us with a lot of information on the company, enough for our audience to go out there and check out what you guys are doing and keep up with some recent news or upcoming news. As a company that's listed on the Canadian Securities Exchange, how do you find your experience?
It's been great. You guys have been very supportive. It's been great to interact with you guys. You've been providing us a lot of support whenever we needed it. And we didn't have to go through a lot of bureaucracy that you often see, which is very much of a hindrance to young companies and companies that are coming up. And I think being on this platform and this exchange and with the growth that we are planning, it's a great marriage, I think. And we're looking forward to being one of the top performers on the index for next year.
Great. Again, I look forward to keeping up with what you guys are doing and hopefully sitting down with you in the future, getting another update. Dr. Essam Hamza, I do want to say thank you very much for your time. We truly appreciate it.
No, thank you for having me again.